So I think the ethical grounds to provide access to kidney replacement therapy is to give the opportunity for patients with kidney failure to live their best possible lives, to try to restore some level of health and to allow them to enjoy and achieve whatever they wish to maximize their capabilities. Because I think especially if one thinks one does not provide kidney replacement therapy but one treats other problems, there's also then an inequity. If you have kidney disease, you're relatively undertreated compared to others. So I think also with regard to provision of treatments for other disorders, I think one should provide treatment for kidney replacement therapy on a basis of equity as well.
I think the most important thing is that nobody should be allowed to die because of that. It's a human right for everybody to have access to treatment. Setting priorities in prevention is key. We must prevent. So we can't just stay and wait to treat. And then we need to avoid futile or burdensome treatment.
ถ้าเป็นจริยธรรมขั้นพื้นฐานเนี่ยเราก็คิดว่าเป็นเรื่องของผู้ให้บริการเนาะบุคลากรทางการแพทย์ทั้งแพทย์และพยาบาลแล้วก็ผู้ที่เป็นเจ้าของการจัดการบริการในส่วนของระดับภาครัฐนะคะแล้วก็ภาคเอกชนเนี่ยนะคะทั้งหมดเนี่ยต้องมีจริยธรรมขั้นพื้นฐานที่สำคัญก็คือเราคิดว่าเป็นการให้ข้อมูลที่กว้างขวางครอบคลุมทุกmodality หรือว่าทุกระบบของการรักษาการบำบัดทดแทนไตโดยที่จะต้องพิจารณาอยู่บนพื้นฐานของมุมมองของระบบบาทของแต่ละคนเช่นในมุมมองของอายุรแพทย์โรคไตการมองแบบจริยธรรมพื้นฐานก็น่าจะเป็นการให้ข้อมูลที่ถูกต้องแล้วก็ต้องคิดถึงผู้ป่วยแบบองค์รวมอันนี้น่าจะสอดคล้องกับของพยาบาล
The answer is a big yes. It is because it's only through mutual participation and understanding between the healthcare provider and the receiver will the delivery of care be enhanced and be improved to reach the goal of treatment. I think patient's experience is something which the physician may sometimes undermine. So I think the patients would have to take the lead to report any symptoms, to report their needs. So if the patient participates, if the patient is empowered, let's say in terms of fluid consumption, salt consumption, to then adjust their dialysis regimen.
In all cases, every patient should be empowered to take informed decisions. As caregivers, we should give balanced information. When we counsel our patients, it should be clear that we are unbiased. It should be clear that we do not have any conflict of interest. We should provide all information freely and in very unambiguous manner to the patients. I think in considering any treatment modality, it is good to consider the patient's perspective and bring the patient to participate in that decision-making process so that whatever decision you eventually arrive at will receive maximum cooperation from the patient, will improve their participation, and will improve even their quality of life at the end of the day.
If patients could know what is better for them, they could make better choices. Also, when patients are on kidney replacement therapy, if they are aware of what is better for them, they will probably be more compliant with the treatment, and that will reduce the complications that are frequent for these patients.